welcome to the UR-enabled Adult Amputee Adapted Exercise series. This video is about making fitness work for you. We explain how and why to start moving, why movement is important, the background of the UR-enabled program, safe progression and limb care. Before we start, it's important to make clear that this doesn't have to mean starting with a strenuous exercise. We start with moving, and when we are ready, we progress. The UR-enabled program was first created for amputees who asked for something to help them return to activities after they had been through prosthetic rehab. This led to several years of research, experimentation, and finally a trial where we saw the impact of the program after 12 weeks, increasing strength and physical activity levels. Participants reported they were able to return to activities that they love or take up new ones. But we also found that to support your independence, more information was needed on how to improve fitness over time. Physical activity is a powerful thing that people can do to manage their own health. If performed regularly, it can have lots of benefits, such as improving blood flow and heart function and managing diabetic conditions. It can be used to improve functional ability and independence in daily life and for weight management. It can also improve mental health, confidence, quality of life, and give more opportunities for socializing. If you start with understanding that physical activity is any bodily movement, and except for in rare cases, any amount of physical activity is better than none. So the first goal is to just start moving. That doesn't mean it should substitute medical intervention, and it is important you should ask your doctor before you start a new exercise routine to ensure it is suitable for your health needs. Physical activity and exercise doesn't just mean getting out of breath or lifting heavy objects. There are several components of fitness, all of which play a role in sport, exercise, and daily life. In UR-enabled, we focus on the following. Balance, our ability to control our center of mass and stay steady. Training balance enables you to move safely and reduces the risk of falls. Cardiovascular endurance, the ability of the heart, lungs, and circulatory system to deliver oxygen to the muscles. This helps you to do more for longer. Muscle strength, the ability to produce force in one effort, like lifting a weight up and down. Muscular endurance, the ability to use your muscles repeatedly or hold a position over time, like carrying shopping bags or standing for longer periods. Strength and endurance together are vital for posture and daily movement. Flexibility, the ability to move a joint through its full range or how bendy you are. Being flexible helps prevent injury in exercise and daily life. Coordination, the ability to transition smoothly between movements, great for sports skills like throwing while moving and daily life. Agility, the ability to quickly change direction, for example in all the stop-start walking in crowds or dodging an opponent in a match. All of these components can be developed to support your fitness and independence. So, how do we progress safely? The key is progressive overload, gradually increasing the load on your body to stimulate improvement. Progressive means building up slowly. Overload means adding more challenge than the body's used to. In simple terms, we make small, steady increases so the body adapts and grows stronger. That's why UR-enabled offers different levels of intensity to help you progress safely and effectively. The most important thing to remember, start where you are. You can't go from 0 to 100 in one session, and that's okay. What matters is steady progress and consistent effort. And yes, you do have to push yourself a little. Improvement only happens when you step outside of your comfort zone. If it already feels easy, your body won't change. For example, if you normally lift 2 kilograms and jump straight up to 10, you risk injury and a setback. But if you always stick to 2 kilograms for the same reps and sets, your muscles won't adapt either. The goal is to find that sweet spot where it's challenging but safe. Here are some ways to progress. Add more weight or increase the body weight you're moving. Increase volume with more reps, more sets, or more sessions per week. Adjust the load, like shifting more body weight throughout the working limb. Increase speed or complexity when you're ready. Raise intensity, so you're working harder, breathing faster, or your heart rate's up. Remember, intensity is personal. Find the level that challenges you and build from there. Now, let's look at some examples for each component of fitness. These are just a few simple ways to put progression and that little push into practice. Balance. Increase intensity by changing how much your body has to compensate to control balance. For example, move from the flat floor to a wobble cushion. Cardiovascular endurance. Progress by moving faster or doing your activity more often. Muscular strength. Increase the weight you're lifting or carrying. Muscular endurance. Try more repetitions or more sets of the same number of repetitions. Flexibility. Move from static stretching to more dynamic versions. Coordination. Perform more complicated sets of movements. Agility. Perform the same exercises at a higher speed. Equally important to your progress is taking care of your prosthetic and your limb. Regular care helps prevent problems and keeps you active. At You Are Enabled, we emphasize checking your residual limb regularly, especially if you're new to exercise. Sweat is salty and can soften the skin, cause friction, or make your prosthetic slip. Keep an eye on your prosthetic, look for any signs of wear and tear, and make sure it still fits well. Do the same for your liner, check that it's in good condition and fits smoothly against your limb. Your residual limb should also be reviewed often. If you notice any changes, redness, soreness, or discoloration, stop and contact your clinical team for advice. When exercising, it's a good idea to check your limb during and after sessions. And for more detailed guidance, our partners at LimbPower have an excellent booklet on limb care and what to watch out for. To recap, this program was created to support prosthetic limb users in staying active after rehabilitation. Physical activity brings powerful benefits for the body and mind. Safe progression through progressive overload helps build fitness without injury. And consistent limb care ensures you stay comfortable and able to exercise. By working on different components of fitness and progressing safely, you can build strength, balance, and confidence, and return to the activities that make life enjoyable. Thank you for watching our Making Fitness Work For You video. Now we recommend you start with our simple warm-up before selecting the right intensity of activity for you.